In the special considerations in pediatrics is that we need to pay attention to the pressure settings because, as you can see in neonates, the pressure range is between 50 to 75. In children to adolescents, you can go up to 75 to 125. But what is the key difference in between them is that in pediatrics, we use the continuous mode, we don't use the intermittent mode. Why? Why is it recommended to use the continuous, not the intermittent? Anybody knows? No? Because continuous, it causes less pain for the children. If you use the intermittent, this will create more frequent cases of pain for the pediatrics. That's why it is recommended to use the continuous and not the intermittent. The periwound skin protection is very important because the skin of the babies is highly susceptible to have macerations around it. The pain management, of course, before and during the application. And finally, the device seal integrity. This is very important in children specifically because you know children move a lot. And any slight movement can cause the dislodgement of the dressing if it was not properly sealed. So that you have to do another dressing for the baby and cause another pain episode for them. Okay, the types of pediatric dressings and their applications. When we're talking about pediatrics and adults also, as our previous speaker said, it's very important to choose the correct dressing for the correct tone. And no one dressing is applicable for all the cases. What are the key considerations that we need to take in pediatrics? Transparent film dressings, as I told you, it's used for either protection, to observe the site under it, or for the secure of devices like, for example, the IV cannula, the central line. So we use transparent films as well. The hydrocolloid dressings are usually, in general, used for minimal exudating wounds. But in neonates, they are not highly recommended. Why? Why hydrocolloid dressings are not highly recommended in neonates specifically? So how do hydrocolloid dressings work? Do you know? Hydrocolloid dressings, they are used for minimally exudating wounds, correct. And they need specific temperature for them to properly function and for them to properly be adhesed to the skin. So in neonates, since they are premature, or sometimes even if they are not premature, they have problems in their thermoregulation. So actually, even if you apply the hydrocolloid dressing, it will not be effective. If there's any problem in their thermoregulation, the hydrocolloid dressing will not be functional in neonates. The hydrogel dressings, usually we use them for what? 100%. If you have a dry wound or if you want to emphasize the alternative debridement, the foam dressings, minimal, no, actually moderate to excessive also sometimes wounds, and for protection as well. The alginated dressings for cavity wounds or if there's highly exudating wounds, and the antimicrobial dressings. Okay, all of the other dressings are very straight to the point, we know what to use them, they are very easy. But antimicrobial dressings, this is my special consideration when I'm talking about pediatrics. Why? What are the antimicrobial dressings? Can you give me examples? Silver, thank you. Other, the new arising dressings. Honey-based dressings, correct. What else? Iodine-based dressing, thank you for mentioning this. This is the one I was waiting for. What else? Have you heard about the PHMB dressings? Okay. So these are the common antimicrobial dressings that currently all of us we are using them. So what are the special considerations in pediatrics? If you want to use silver dressing in pediatric, what is your number one concern? Or how do you select an appropriate silver dressing for pediatric population? Type of wound, okay. So you need to have an infected wound definitely because you're using an antimicrobial. Is it the first line treatment for an infected wound in pediatric? Okay, what is the first line treatment for an infected wound? Or what is the first line antimicrobial dressing for an infected wound in pediatrics? In adults, we go directly to silver. Directly, we go to silver. Silver leads to something else and not purely only silver sometimes. Okay, but in pediatric, okay, you need to know that in pediatric we are afraid about systematic toxicity. Because pediatrics, due to the immature skin integrity, they have high absorption tendency. So they can absorb medications more than the adult skin would. So maybe a minimal application of any cream, the neonate or the pediatric will absorb it way faster than adults. So we need to take special precaution when we're using silver. For neonates, we cannot use it more than 14 days. This is number one. And during the application, if highly needed, we need definitely to do always renal exams and to monitor any systematic toxicity. But still, you did not answer what is the number one. It's not silver. not silver. Actually, it's the honey-based. Any honey-based dressing. This is the number one if it's not highly infected. If the honey-based did not work, we go to silver. If the silver did not work also, the second safe treatment, antimicrobial for pediatric, is the PHMB. You've heard definitely about it. It's very safe. It does not have any toxicity outcomes. And the least recommended is the iodine-based dressing. Previously, they used to use it a lot in pediatrics, but recently it's the least recommended because it has a lot of effect on the thyroid development. So that's why even if we have to use it, we need to always do the TSH and the thyroid panel. And at the same time, we cannot use it for more than 7 days. And if the baby is born less than 37 weeks of gestational age, we cannot use it. It's not recommended at all. Okay? So my key takeaways in pediatric wound care, just to sum up everything I have mentioned, it's very important to always know that our pediatric population are our special population. So we need to always know and take into consideration that they are unique, not only in their presence, also in their skin. We need to always have a proactive prevention to avoid any long-term outcomes, because any complication that the baby will develop as he is young, it will go with him as he develops and as he grows. We need to choose appropriate dressing selection, as based on what we mentioned before. For the negative pressure wound therapy, it's very important to mention that we use it mainly for burn cases, and in case we have to use it, we need to follow the proper precautions in pediatrics. The pain management is very important, the atraumatic care that we provide for our babies, and definitely the minimal handling protocol in critical patients. And you can notice that I have put a great box here. I decided to put it in here, which sums up everything I always say. I would like to end my presentation with this sentence: wound healing or wound care is not a one-man show. If we don't all work together, if not all of us, we have input in wound healing, we will never achieve a great wound. Okay, thank you. Any questions?
Really, it was a very informative lecture. We enjoyed and we know more about the pediatric wounds. Please, now our next speaker, Ms. Lamid Husseini. She's from King Fahd Complex Hospital. She's a wound care. Welcome.
Assalamu alaikum wa rahmatullah, and good morning again. Hope everybody's still awake. My name is Lamid Husseini. I am a wound management nurse working in King Fahd Military Medical Complex for some years in wound care. My topic today will be talking about personalizing treatment strategies to meet individual patients' needs. First of all, I would like to send my gratitude and thanks to Malak for inviting me for this yearly workshop. I'm happy actually to be part of you guys to exchange my knowledge, simple knowledge and experience with you as well, as you are a practitioner. So feel free to talk and feel free to ask a question even at the middle of the topic. So what do we mean from the title? What do you think we mean by personalizing treatment for patients based on the needs? Let's go through it in details. My objective at the end of this presentation, I'm expecting you as an audience to know about customized wound treatment plans, to be able to know your initial evaluation for wound assessment, to know how to diagnose and what's the test that you need to diagnose our patients with wound, identify risk factor and infection, and to know the importance of surgical intervention and physical therapy and rehabilitation as well, dealing with patients with wounds, and use advanced technique and technologies and some scientific studies upon this topic. Let me tell you at the beginning, as introduction, I'm very proud, first of all, to be a nurse, and then as a wound management nurse. Nurses are playing a crucial part in treating patients with wound, variety of wound they are dealing with, and customized treatment is very essential for optimal healing and minimizing complication, considering each patient's unique health conditions, preferences, and wound nature. So what do I mean by this, in shortcut? So in shortcut, we're saying not all patients with laparoscopic procedure post, we will deal with them as the same. Not all the patients with pressure injury stage 2 will be dealt with it as the same. So this patient number A having laparotomy, let's say, you're treating that wound with the dressing, it's not necessary to do the same dressing protocol for patient laparotomy B. So deal with the patient as a unique based on a lot of information that you have to dig before treating the wound itself. So for example, we as ladies, right? Inshallah, we're going into Ramadan month and Eid, right? So each one of us, when she go to the mall for shopping, she will choose her dress based on what? Based on the trend nowadays, based on her skin color, based on her weight at that moment, and her preferences, right? So we are not all choosing the same dress, for example, as well as the gentleman, right? So it is the same when you are dealing with a patient with wound. Not all stage 2 in all patients will be the same. Not all the burns in the same patient will deal with it the same. This is what we mean by personalizing the patient treatment plan. Of course, patients with wound based on a lot of factors. Let's know more about it. First of all, you have to do your initial evaluation. What do we mean by that? Initial evaluation involving taking detailed patient history, which we all studied in nursing. So first of all, general history, then also history about his medication that he had using, history about also operation that he did before, and identify the preliminary symptoms to guide us for further diagnostic procedures. Key elements in wound assessment factor. I will not go through that in details. Our colleague Ali went through that. But basically, doing the assessment, you have to be able to know what is the wound type when you are dealing with a patient with a wound. Meaning to say, you have to know, am I dealing with a acute wound? Is it less than 4 weeks? Or am I dealing with a chronic wound which has been there and stubborn for more than 4 weeks? The management will be different. Am I dealing with a pressure injuries or traumatic wound or post-surgery or infected wound, diabetic wound? So the etiology of the wound I'm dealing with is important also, because you will be able to know how to manage the reason and also involve the right person also in the management with you, as my colleague a while ago said. Dealing with wounds is not only you as a wound care nurse. You have to have your good relations with others, good communication, because you will need multidisciplinary team with you in treating that wound. You have to be able to know the size and the depth of the wound measurement, and that is different in each institution and depends on your policy. In my hospital policy, like we're measuring the wound every 7 days. And the purpose of that, there is no changes in the wound within 1 to 2 days in the size I'm talking about. So every 7 weeks, the nurses are obligated to manage, to measure the wounds in order to know my wound is healing, is it getting smaller, shrinking, epithelializing, so it's smaller in size, I'm doing well. Or my wound is getting bigger, the peri-wound skin is wider, there is moisture, I'm not on the right track, that should attract your attention. So measurement can tell you a lot as well. Exudate also, as our colleague a while ago said, exudate type and volume can tell you, am I dealing with a healthy wound or am I dealing with infected wound? What do I need to do if there is extra exudate and type of exudate and color of exudate there? Is it serous? Is it serous sanguinous? Is it purulent? I'm dealing with infected wound and how to get rid of that. Infection signs, we'll talk about it a little in our next slide, and medical history, as we said, it's not only patient history. As a medical, you have to know, is your patient smoking? Yes or no? Is the patient having happy bubbly and those kind of things? Yes or no? Is the patient having alcohol? He drinks alcohol? Yes or no? All of this will affect, Is he using immunosuppressive medication or steroids? That will delay your wound healing, so you have to know also before dealing with that wound. Is he vascular patient? That will affect also your healing. Is he a chemo patient or cancer patient? That will affect my healing or slow your healing. So you are anticipating the healing process prior to deal with the wound as locally. It's not only the dressing that you are putting. There is another wound, another reasons for your wound to fasten the healing process or to delay the healing process. We have to do some diagnostic tests. We have to dig on sometimes. We as a nurses sometimes we're even asking the doctor, I need to know about the white PC in this patient. I have to know about hemoglobin level in this patient. Can I take sometimes X-ray if there is a bone involvement? I need to know what's going on underneath. All of this will help you for accurate treatment planning for this patient A that you are dealing with. Identifying infection risk, how to know that your wound is infected or not. You can read more, or maybe you know about it, nerds and stones. So using nerds and stones as a guide for your infection, level. If you're having 3 positive nerds, then you are dealing with superficial infection. You can treat it locally. And if you have a 3 and more positive stones, you have to know that you're dealing with systemic infection. So I need to involve my medical team. I have to involve infection control team. I may need to take a culture in order to start systemic antibiotic. So based on the assessment level for your infection, you have to deal with that wound. Deal with it early, before complication happen, before pus can happen, before septic shock can happen of the patient, and the reason that is the wound only. Medication typical application. Medication typical application prescribed based on the diagnosis that you find out, including antibiotic. Does he need anti-inflammatories or ointment to manage the symptom and promote more healing? Do I need surgical intervention in dealing with the wound? Yes, I may need to have surgical intervention. If you are licensed in your country to do debridement, for instance, or ask the specialist or the doctor or the GS team to do debridement for you. So yes, I may need to do a surgical intervention in order to treat the wound or prepare your wound bed. Or sometimes you need to take the patient back to OR, really surgery was not successful, you have to do again opening and cleaning in order to start your healing. Okay, what's the reason or why there is physical therapy and rehabilitation here? Physical therapy and rehabilitation play also essential part actually in wound healing, restoring the function, improving mobility, and strengthening the muscle after surgery on a post-op patient, those with wound. Okay, alternative therapy. So do we need alternative therapy? Do we have it? Yes, we have it in our culture. There's something called acupuncture and there is something called chiropractic care available. And those type of treatments, sometimes we use them as well as those patients with wounds, specifically chronic wound, are dealing with a lot of pain, and sometimes they are stressed and they are depressed because their life now has changed dealing with a wound, and he have an open, he has to do his life ongoing with that wound. So we can help those patients having such alternative therapies to reduce the pain and to reduce the stress and discomfort and the depression that he have, using acupuncture or chiropractic care and some herbal treatment. Let's go to our core of the lecture here, which we were going to talk about the latest patient-specific customized techniques. So what do we have available in the market nowadays? That is actually the interesting in wound care. It's a medicine itself, which is every now and then are developed in the market. So you have to compete and you have to keep yourself up to date with the latest trend available in the market. Whether it's available in your institution or no, it's not necessary. But as a wound care, you have to be aware and you have to have the knowledge of what is going on around us and what is available in the market to be used. First of all, we're going to talk about the famous maybe 10 available now, which is bioprinting and 3D printing technique. I'm pretty sure that all of you heard about skin grafting, which is tend to be used a lot by plastic surgeon, right? So it's one of the modern technique which allows us to creation of customized skin graft that match the body or match the patient wound and anatomy, shape and size. This printed structure can contain cells and growth factor biomaterial which can help in promoting healing. And there is a lot of studies about the importance and effectiveness of skin graft. Personalizing wound dressing. Advanced wound care dressing can be designed to fit a patient's specific wound, size and shape, ensuring more efficient coverage and faster healing for those patients with wounds. You can go through that in details. A lot in the box are available studies to show about the importance of skin grafting, the right way to do and when to do, and how effective in promoting wound healing and wound closure. This is the technique about it.